Hello and welcome to Youth in Sports, where every Tuesday night at 7:30 p.m. we feature special guests from near and far. The program is sponsored by ATI Physical Therapy, providing certified athletic trainers to more than 30 area high schools and colleges. First State Orthopedics, the team taking care of Delaware with a commitment to excellence. And Wilmington University, where Youth in Sports is produced by the College of Technology's students and faculty. And now, from the studio at President Jack Barcelona's Wilmington University, your hosts for Youth in Sports, AOSSM Mr. Sports Medicine 2012, Dr. Michael Axe, UD and St. Elizabeth's own Dr. Joseph Straight, and co-founder of Youth in Sports, Mr. Walter Laudine.
Good evening. Welcome to Youth in Sports. I'm Walter Laudine. Welcome to beautiful Wilmington University, home of
the Wildcats.
Slowest Otis elevator I've ever seen.
Because most of us walk. Most of us walk. Dr. Michael Axe, more fit than Walter Laudine, I might add. And tonight's show, we're going to showcase our other co-host, Dr. Joe Straight, and all the programs he's doing since he joined us full-time at First Day Orthopedics in September of 2013. Welcome, co-host.
Thanks for having me on the other side.
Joe, pleasure to talk to you because you've been a great co-host, and it was a pleasure that you came in. We really enjoyed you. I remember when you played ball with my son. Tell us about your schooling, Joe, and how you got started.
Well, I grew up here in Delaware.
Local boy.
I am. I grew up actually over off of Falkland Road and went to St. Catherine's, St. Edmunds, St. Elizabeth's for grade school.
Did you see Craig at St. Edmunds too?
I did, yeah.
No kidding.
We were in the same class.
Wow.
And then I went to St. Elizabeth's in 6th grade, decided to stay there. So I played high school sports for Coach Beto and Coach Hempel, who are as well still there. And
unbelievable, isn't it?
It is. It's amazing how long Joe's been there. I want to say he's got to be in late 30 years of coaching there.
Wow.
So, and Coach Beto was my high school baseball coach, and he still coaches baseball there.
Still coaches baseball. We had him on many times.
So after St. Elizabeth's, I decided I wanted to stay again at home. I guess you can call me a mommy's boy. So I wanted to stay close and went to the University of Delaware. And
when did you decide you wanted to be a doctor, Joe?
Well, and I've been on the show before. Back in, I think it was 2009 or 2010, I did the show and I explained that I'd had a knee injury when I was a kid. I was actually 12, and Dr. Newcomb over at First State Orthopedics actually saw me. I had multiple knee surgeries, and throughout my high school career had multiple, even more surgeries. So Dr. Newcomb finally looked at me and said, "You're not going anywhere with your sports career. Why don't you go to medical school?" So I spent some time with Dr. Axe as well as with Dr. Newcomb in the office at First State.
Yeah, they do that. I think that's great.
Always.
Every time I've been there, it's always been a young
That's one of the
physician
things
in
that
training.
now that I've been working there, I offer that to kids. I've actually offered that to 2 kids in the last month.
I think it's a great way to.
Let me qualify what Dr. Straight's speaking to. Sometimes you have career days, and if you want a career week, we usually restrict it. Dr. Straight's pretty restrictive to St. Elizabeth students because that's where he went, and there's a lot of kids that apply. So if he has someone, obviously we can't have 2 or 3 things. So we have students from high schools, we have students from college that think they want to go to med school. So we have students in high schools that want a career path. Then we have people from college who have chosen a career path, and now they're trying to fully define, do I want to be an orthopedist, do I want to be a cardiologist? Then we have kids from medical school who rotate through on rotations because we're one of the places that they can do that as one of their formal training. Then we have residents who come from primary care to do rotations for us in outpatient musculoskeletal expertise. Then we have fellows that are, after they're decided and finished their residency, they then do time with us and take care of teams with us and are with us in our clinics. And then that doesn't count the visitors.
We've done nurse practitioner students. We've done athletic training students from the University of Delaware. So we're a little bit busy with learners and education, but we do, like you said, St. Elizabeth's, I've tried to get kids in if they would like to.
So what do they do? They write in and ask for?
Actually, I've actually had them ask me, this is what I'm looking to do, Doc. Is there a time when I'm home that I can come in for,
it's on the sidelines of their games.
Oh, yeah. That's so, okay, you're at the University of Delaware.
Mm-hmm.
You're deciding on a medical career?
Well, I had decided before that. I was probably about 16 or 17. I was at St. Elizabeth's at the time.
So when you went to the University of Delaware, you knew to specialize, like Dr. Axel was talking about, what classes to take to go to pre-med. And
I was lucky as could be. I mean, I want to say I put hard work in, but I was lucky. The program there at the University of Delaware, which is still going on, was actually the Medical Scholars Program. It's changed a little bit. It's actually become, I guess, more sought after, I mean, now. But I went there and decided that's what I was going to do. So I went into the Medical Scholars Program under Dr. Paul Durbin at the time.
so there's a program at the University of Delaware and at some other schools, I presume.
No. What happens is, because Delaware has found it to be fiscally responsible not to have a medical school, and I support that 1,000%, they rent spaces from Jefferson. They rent 25 spaces for $1 million. That the state pays both PCOM, Pennsylvania College of Osteopathic Medicine, and Jefferson fees to give preferential consideration to our students who are qualified by their standards.
Exactly.
Wow.
So there's qualifications you had to meet. You went through
Right.
a program. It was actually it was a liberal studies program.
No, it has to be, he has to maintain a 3.5 in whatever program he decides. So if he went into engineering, and he has to maintain the same 3.5 as if he went into hotel and restaurant management.
And what it was for us was it was a 3.5 in science and 3.5 in non-science. You had to have them both.
Okay, so you had to you have a 3.5 together.
So my degree is actually a
Cumulative.
Bachelor of Arts in Liberal Studies. So I did a liberal studies major, not a biology major like you would, I mean, like has been the thought that you had to. But it's a liberal studies major. And I took science courses, non-science courses, prerequisites for medical school.
So you graduate in 4 years?
I did.
Okay, which is unique in today's
You
world.
have to in that program.
You have to.
You have to graduate. And what he didn't tell you is there's another requisite at Jefferson. You have to have your MCAT scores have to be 27 or above with a minimum of 9 in each of the 3 segments. So not only did you, and the reason why they do this, Walter, and the reason why there's standardized tests, and I wish I had a better suggestion, but I don't, is the only way that you can compare university acquired knowledge is by taking a test that everybody from the university takes. So that all universities have to, you don't get singled out because you went to Harvard and therefore you don't have to take the test. It may help you with a grade point average. It may help you if you went to a very difficult school like Swarthmore and you had a 3.4. That may be worth a 3.8 or 3.9 somewhere else, but you better show up for the test.
It's trying to compare apples to apples and not apples to oranges in the long run. You may be taught something at one school that you're not, and you do very well at that school.
Right.
Whereas someone else was taught something at a harder level, or the course was different and it's a lower score. You can't compare those.
So now you had the 4 years University of Delaware.
I did.
What do you do now?
I actually took a year off in between the University of Delaware and going to Jefferson.
That's
I had already
rare,
committed.
isn't it?
I want to say it's
Makes
less
a lot of
common,
sense.
but I did it for just so that I could travel. I did it, and I actually at the time I took classes at Del Tech, so I became a student at Del Tech at the time and took medical terminology. I took some courses I thought would help me as I went to medical school, but I also used it as a time to travel, do things for my family.
Okay.
And before I went away.
What about, how did you choose a medical school?
How did I choose the medical school?
Well, no, that was already chosen, Walter. That's what the Med Scholars, right.
When I went there and joined the program, I was
So you joined the program, you have to go to Jefferson.
Well, only the Med Scholars. Jefferson has 25 slots for which they've allocated between 10 and 15 to the Med Scholars program.
Okay.
The other 10 spots are allocated to Delaware citizens who pay taxes.
Okay.
Okay? They can also be U of D students, so it can be Delaware people who pay taxes that went to other schools.
Delaware students.
Or they can be students who go to the University of Delaware who elected not to be in the Med Scholars program. So that there were some that didn't want to be restricted to Jefferson, and therefore they did not choose to take one of those allocated spots.
And you're not really, I mean, when I say you're restricted, let me go. If you make the grades and do everything, that's the seat that you're allowed to have. You can, and I don't know if it's happened, but you can decline it and go somewhere. You can apply somewhere else. It is still, I mean, at the time, I know
Well, if you got the marks.
Right. Exactly. And Jefferson being a great school.
Yeah, Jefferson's a great school, right.
I mean, I don't know anybody that did, especially in my year. We only had 17 people at the time.
I think there was a contractual relationship that you would take that spot, but I'm not absolutely sure, Joe.
Because it was early. It was an early acceptance.
Yeah, you already had a spot, didn't have to go through all the interview process that everyone else has to do. and wait. It's yours to have. I guess you could turn it down.
And yeah, don't turn it down, right?
Okay, that's what I said. I don't think anybody.
Well, money will do that. The top kids like Joe and I paid to go to school, and we'll get to that in a little bit. But there are some kids that actually got a full boat at other places. And well, if you're getting a full boat to Michigan, or you have to pay to go to Jefferson, well, what are you going to do? What are you going to do?
And being a parent, you might want to, you know.
Right.
Okay, so now you're going to Jefferson. You did 4 years University of Delaware. You did the program for Jefferson. Got accepted to Jefferson. You're at Jefferson. How long do you stay there?
So you're there for 4 years of medical school.
4 years of medical school.
4 years. So your first 2 years of medical school is pretty much bookwork. It's educational bookwork, courses, pathophysiology, neurology, pharmacology, anatomy. They go through the main things of medicine in a sense, biochem. And then your last 2 years, which is third and fourth year, you're actually doing rotations. So you actually rotate through hospital systems, through family practitioner offices, like Dr. Axe was saying earlier.
Like he was talking about.
That could be a rotation for a medical student.
Now, when you talk about rotations, you know, Mike knows all this and you know all this, but I don't. And
That's
I know a lot of
fine.
people
Well, then
don't.
ask the question.
If you do a rotation, when do you decide, okay, I want to be an orthopedic surgeon, or I want to be a dermatologist, or
You
I
want to take that one because that's a fun question.
There's a lot behind that one, because I think that a lot of people go with an understanding that this is what they want to do. And some people stay with that, and then some people change. And you look at the lifestyle, you look at the amount of time it's going to take of your life, and I think people look at the financial reimbursement of everything, and that kind of changes as you go through from first to fourth year. Those last 2 years, you start looking at different things.
We have 2 minutes, but I want to just take that so that people were clear. Joe and I attended Jefferson, 20 years apart?
Mine was 99.
99, and I graduated in 79, okay? So you have a full decade, or I'm sorry, a full generation of difference in attitude. There were many people when I went to school that really didn't know what they wanted to do. And therefore, they were using the rotations, the 6 and 12-week rotations, to be able to further define what they wanted to do in life. I knew what I wanted to do, so it made it very easy from the get-go on what was going to happen. But in Joe's generation, I think they had already declared more before they got to the rotations. So you could tell the people we used to kid about, the ones that wanted good grades, they would tell that whatever rotation they were on, that's what they were going to do. Yeah. So that when they got evaluated, see, on your own rotation, there's two things. You get graded.
Yes.
Okay.
And you have to take a test on that information.
So you are tested,
so
but you're evaluated by the residents, by the attendings that are of that department. So
Joe, you do a rotation with Dr. Axe.
Yeah, I mean, you can. I did not.
You did.
I did not. I did that when I was in high
different
school.
Yeah.
I did that before I went.
Okay. So if somebody when somebody does a rotation with Dr. Axe in his third year, let's say, Dr. Axe grades them.
Yes.
I don't usually, that's usually in the hospital, and we can come back to that because that is a little confusing. We're going to go to a break here shortly. But we'll talk about the difference between rotations as a third year, which is fully defined, and rotations as a fourth year, in which you get to choose how you spend your money. We'll be back right after this.
I will keep dancing on point, even if it hurts.
My arm is killing me. I don't know if I can pitch another ball. But I'll just play through the pain anyway.
I have to do the big stunts. To look better than the other cheerleaders, our tosses are bigger.
My elbow really aches, but I've got to keep practicing.
Don't tell them it hurts. It'll take you out of the game if you do. I have to push harder if I'm going to get a scholarship. I'm feeling dizzy, but I don't want to tell anyone.
Everyone's counting on me. I can't rest now.
Nearly 50% of all sports injuries sustained by middle and high school students are from overuse. Don't play through the pain. See your healthcare provider and follow their instructions for rest and recovery. Take the pledge. Become an advocate for sports safety. Visit stopsportsinjuries.org.
Go team!
Hi, we're back on Youth in Sports. We're talking to First Aid Orthopedics, Dr. Joe Straight, and also one of our co-hosts. And
my full-time colleague now.
Full-time colleague, which is a full-time job, believe me.
Yeah.
Joe, we were talking about, like, you're now at Jefferson. You convened at University of Delaware 4 years. You're now at Jefferson. First 2 years, we talked about basically all the books. Okay.
Yep.
Now you're in your third year, and in your third year, you do rotations.
Yes.
Now, explain how many different kind of rotations there are. And is those rotations, are those where you decide, oh, I want to do this or I want to do that? Or
well, what happens
if
is
you don't know?
In your third year, you actually are set on a schedule of type of rotations that you have to go through. Now, it's not everybody does the same thing at the same time. It's kind of mixed throughout the year, but you do family medicine, internal medicine, OBGYN, surgery. You do the generals. And it kind of gives you a background and a basis for developing your medical knowledge. So that's third year. And you'll go through about 8, 9 rotations. I don't know exactly how many there are. They could be 2 months, 3 months.
That's a lot of stuff because you're getting tested on this stuff. And
it is.
It's a lot of stuff.
And there's some places you have to be there at 7, and other places you have to be there at 3:30 a.m.
There was many times.
I got, you know, you talk about pet peeves. I got a peeve before we get into anything.
No, if you have to pee or peeve?
No, peeve. what you talked about before, about all these rotations all this time, all I kept hearing is when these on the TV shows, when these doctors first start, they're 48 hours, 52 hours, whatever. To me, that's to save the hospital money because apparently hospitals are not money-generating operations, and I don't know why they do that, because to me, it'd be my luck to get a doctor on his 52nd hour. I don't know why they do that.
You want to put this to rest, please.
First of all, that doesn't happen today.
It doesn't.
I do believe that it was never in those numbers. I do believe that back when Dr. Axe did his residency in medical school, and probably about, I'd say 10 years before I was doing it, that they were working exorbitant amount of hours, 100 to 120 hours a week.
Which to me is not good.
It's a lot, but I mean, this is how our medical system and education is set up from the get-go.
Walter, are sprints good at the end of practice?
Yeah.
Why?
They leg you up and improve your...
When? In the fourth quarter, and if you have to go to overtime.
In the game,
okay?
Right? They keep you good late in the game.
So here's the issue with... As much as our parents would love to believe that we were making critical decisions while we were in these time frames, okay?
You're saying you're not.
We weren't. There was a check and balance system that's so strong. We answer to a higher power who answers to the attending, who answers to the hospital administrator. There are so many things.
That anymore.
And first you answer to the nurse, because she's going to tell you don't want to do that. Because these people are...
They're the ones that you really count on, right?
Well, they've been doing it for 30... They are the sergeants of the military. The head nurse is the sergeant. She is the master sergeant.
Okay.
And underneath her, and they tell you pretty much, Mrs. Smith needs you to go see her because she has blankety blank. Okay.
But Walt, this has changed.
Okay.
So now there's actually laws. I mean, there's laws for residencies, and they've set where you can.
Some programs listen, some programs don't.
That's true.
All right, now Joe, you're in your third year, and thanks for settling that peeve.
Yep.
Because that to me was really important.
Yep.
You're now in your third year. You've done all these residencies. Internal medicine, whatever, psych.
Rotations.
Yes.
Rotations.
Are there any stations for patient-doctor relations? Because I know
that we get from the beginning.
Yes.
That happens in the first year.
And actually, there's actually practicums where you actually go in and learn how to do that. I mean, at Jefferson there was for myself.
Well, it's like telling a family that, their loved ones passed away. I mean, that's a big deal.
I can tell you that during my residency, not even just medical school, during my residency, I actually worked with the person, because I did my residency here as we'll move on at Christiana, and I actually went around at night with the person who had to do those things.
It's a great,
to people who lost loved ones.
Just like
in
a police
ER
officer explaining, it's a really difficult thing.
It's tough. You have to learn it, and you have to learn how that you can give that information and how people are going to respond. So it's something.
And what you're allowed to say, what you're not allowed to say.
No, it isn't that.
Well, Mike, we live in
learn the emotional
society.
part of it.
Everything. It really isn't that bad, Walter. Okay, if you do the right thing, most of the time,
You're right.
okay, nothing bad happens. And if you do it from your heart and you make a mistake and you say, you know what, I made a mistake, people are more than willing to forgive you if it's made honestly. Okay?
Mike, I just don't. I think that you believe that, but
I do. I've lived it. I'm 28 years of experience.
You and I are. I've had a long career in real estate. You have had a long career in medical profession. And a long career in the horse business also. Never been sued, and neither have you, which is a big deal. And hopefully Joe will go on to that. But you know, you see it all the time with these cheap lawsuits.
That's the good news. Those are going down.
Away.
They're going away.
You really have to be, in a sense, you have to make a big error. I mean, if you're doing what's right for the patient, most patients understand that. You know, everybody doesn't get better.
And there are some bad
perfectly.
people.
Yeah.
But they get identified. So let's go. Keep going, buddy.
So
fourth year.
Fourth year. So it's mostly electives. There is some that you have to do.
Okay, what did you elect?
So I actually did sports medicine electives and orthopedic electives at the time.
Okay.
So I did orthopedic at Bryn Mawr Hospital because it was close to Jefferson. I did at Jefferson Rothman Institute. I did some sports medicine stuff. So I had kind of known what I wanted to do when I went to medical school, but by fourth year it was kind of solidified. This is what I want to do. I'm going to get into.
Do most doctors, young doctors, know that in their fourth year?
I think by their fourth year they do. They
Are
have
there
at least one or two
Can they make a
things.
big change in the fourth year?
I've seen it. I had someone in my class that wanted to be a urologist, a doctor who worked on bladders and things like that, and decided to go to orthopedics. It just changed.
Oh, okay.
He did an orthopedic rotation.
Well, I can understand why. There are certain dispositions. The one that really will floor you is if you either have a surgical disposition or a non-surgical disposition.
Right.
It's very rare that you'll change that dramatically.
Yeah,
that you'll go from a
non-surgical
non-surgical to a surgical. Now, I've seen some surgical guys get wigged out by the fact that what they have to do, and they'll do something less surgical. But I haven't seen them go to the dark side and go to medicine.
The dark side.
And I'll be honest, and Mike knows this, I had looked initially to go into orthopedic surgery.
Right.
And I, in a sense, changed my path a little bit.
Oh, wait a minute. You're not an orthopedic surgeon?
I am not. So I do not do surgery.
See, I didn't know that. I thought you were an orthopedic surgeon.
I don't. I do no
Now, your
surgery.
son's an orthopedic surgeon, right?
Yes.
Okay. Okay.
Yes.
So what are you, Joe?
So I'll just go from
Well,
Jefferson.
no, don't leave them hanging like this.
I
Explain
do
what you do.
primary care sports. So
Primary
when
care
I say
sports,
that,
okay.
what that is that you do a primary care background. So it could be family medicine, internal medicine, pediatrics, something like that.
Okay.
So you start with a primary care background, and then you do an extra year of training in sports medicine, which is directed solely at musculoskeletal medicine. So when you come out, you have a expertise in learning musculoskeletal medicine, treating musculoskeletal injuries, diagnosing, using X-ray, MRI, as well as injections.
Now, are you talking? Is this the 5th year that you're doing this?
That would be my fourth.
You're doing this the 4th year.
After your 4th year of medical school,
You know what you want to do.
You do, but you apply for a residency. So there's another step here.
You apply.
You have to apply for a residency.
And you have to win.
Do you apply to different hospitals?
Yeah.
To different, it could be hospitals, it could be different areas of medicine. You have people who apply to emergency medicine and family medicine. So that is now where you will be going, and you do get paid for that part. So this is the first time you start getting paid.
So in other words, if you apply to like Jefferson, where you are,
yes,
they would take the elite people that they wanted.
Exactly. So you may be in a pool of 100 to 200 applicants, and they take
For
7
4
residents
spots,
for 4 spots, depending on what field of medicine it is.
How many? Is there a chance that here you are, 8 years, okay, and you can't find a spot?
It's called a not match.
It is.
Really?
It is.
What happens then?
Well, you can go out and you can actually hang up a shingle. After your 4th year of medical school, you can hang a shingle.
Yeah, but that's
you
so
just won't be
expensive.
board
Usually,
certified.
after your 8 years, you're in terrible debt. To go out and hang a shingle up, you know, and get all the accoutrements that go with it.
I'll tell you this. I think it is getting a little tougher because I think there's a lot of medical students coming out and there's less residency spots. I mean, this is just over the board right now. It's getting less since I actually graduated. But I think that if you work hard enough, you can do years of research. If you do not match, do an extra year of research and go back. And I actually
Will you get paid for that?
I took a year and went and did research in New York after my...
Can you get paid for that?
For the research, it's probably a stipend usually, a grant or a stipend that pays you. When you're in your residency, you actually get paid a sum that's based off of what is set by the, it's called the AMC-GME, but it's the group of residents, head of residents.
It's regionalized for what payment has to be for you to be able to live effectively without going into more debt that you've already done.
From New York to Philadelphia to Wilmington.
It does.
Okay.
It does.
Mm-hmm.
So you got 8 years of school, plus you're taking an extra year to...
I did an extra year of research.
Next year of research.
Orthopedics.
Now you got 9 years. We got 2 minutes left in 9 years. What are you doing now? After 9 years.
So after I finished my residency, I did a year of fellowship after my sports fellowship.
What's a fellowship?
It is that extra year of special training for my musculoskeletal expertise.
Where do you do that?
I did it here. There's multiple throughout the country. I did it here at Christiana. So
they train these folks to be in charge of student health and athletes at various universities. That's the coup de grace job.
Okay.
That they would, many of them go in for that particular reason. They're also would work with orthopedic surgeons as the non-operative guy in their practice to do all the things that don't require surgery and screen all the patients.
Okay.
So they get quality care. When they don't need surgery, they can stay with them. They also are the people that work for all the non-surgical things for the professional teams.
Okay.
So that it's a very very needed position.
All right, we got 1 minute
in this
we'll
segment.
Get into this in the third segment, but you're now 9 years in school, and you're ready to get a job.
Yeah,
no?
It's time. Oh, yeah.
Time.
After your fellowship, it's time to get out there and start working.
Okay.
No, so he has 4 years of college, 4 years of med school, 4 years of residency, and a year of fellowship. So he's 5 out. 5.
Wait a minute. 4 years of
college, 4 years of med school, and now he starts getting paid, but he's got to work for 4 years before he can work a 5th year in fellowship. So we're at 13, brother. You've missed some time.
Plus a year of research. So it took me about 14 years from the first day of college.
Holy God.
Yeah, you kind of missed a little bit.
Yeah, I missed a little bit. We're going to have to get that in the next segment because I missed that.
Well, it's one of those things that people continue to miss. You know, we don't start till we're 31. You'll come back right after this.
What does opportunity mean to you? At Wilmington University, it means providing a personalized educational experience where students learn anywhere at any time. Wilmington University provides a variety of ways to complete your degree. Choose the flexibility of online learning, or attend classes during the day, in the evening, or on weekends at locations throughout the region. It's your degree. Choose how you earn it. Personalized education, affordable tuition. That's the difference at Wilmington University. What does opportunity mean to you? At Wilmington University, it means finding an innovative degree program that fits your goals and prepares you for a successful career. It means finding a school that fits your life. We know the importance of providing individual attention, affordable tuition, and unparalleled flexibility in service. Because at Wilmington University, it's not about meeting your expectations, it's about exceeding them. Personalized education, affordable tuition, that's the difference at Wilmington University.
We're back on Youth in Sports with Dr. Joe Straight, and he's killing me. The poor kid's been in school now for 9 years.
Still in school.
He's getting ready to hit this residency thing. Now explain residency, Joe. 3 years of residency and 1 year of...
It is. Family medicine residency, which that's what I underwent, is a 3-year program. I did it here at Christiana. And then the extra year was the fellowship year. So it was a total of 4 years, in a sense, after medical.
Before you explain fellowship, the 3 years of residency you did.
Yep.
Yeah, we need to move on, Walter. We got to get through this because there's some other things I want to talk about.
All right, you're getting paid for that.
You are. You're getting paid. You do a
Okay,
whole bunch of
and then what's
rotations
the
with people in the
fellowship?
community. Then the fellowship, you're still getting paid, but you're working primarily in the field of practice.
Focused study.
When do you go to First State?
All right, so when I got out, I graduated in July of 2008, my fellowship. I started working with Christiana Care in a medical aid unit and doing some occupational health for them for about, it was 3 months, and then I joined First State in January of '09. And I worked part-time with First State Orthopedics, and I worked part-time with Christiana Care.
Okay.
So I worked a part-time job up through 2011, and then the same practice I was with Christiana was bought out by WorkPro. I worked for them for a little bit, and then in September of this year, 2013, I joined First State full-time.
Okay. Okay.
So,
all right. Now, go ahead.
Now you okay?
I'm okay. I'm
all right. So
oh, wait,
now,
one more
and
question.
I did get paid most of the time through that.
How much did your whole education ballpark cost you?
So are you counting University of Delaware?
Yeah, sure.
Okay. So my parents paid for most of University of Delaware.
God bless them.
Which is a great benefit to me. I think I only carried a little bit over from there. My education was at Jefferson was about $48,000 a year.
A year?
A year. And that was the total amount that needed to be taken out. And that was for living and food. It's a total amount. And that was split up between federal loans and institutional loans. So I still have federal loans that I have to pay off.
Which, no matter if you go bankrupt, people, you still have to pay.
And they're at a low interest rate, which is really nice. And you know.
Yeah. Well, here's a plan for you. Everything's at a low interest rate,
perfect.
including your money that's saved.
But at the time that I took them, that I took the loans, which was back in 99 through 2004, it was at 3%.
Okay.
So it was even back a long time ago. So the federal loans were great for the time that I went through.
So when Joe was going and finishing the jobs that were available for primary care sports, what we tried to do, being involved in the fellowship, is to make them musculoskeletal experts, which means that their diagnostic skills were equal to an orthopedist.
Okay.
And therefore, they were great people to have involved in your program so they could pre-screen the people so that they would have good care. And it was non-surgical care was what was rendered, then if that's all they needed, but also the skill set to know when they needed to have surgical intervention. Okay?
Okay. Now, I know that you, as a very, very good doctor, and also First State Orthopedics is a great place. When you hire people, you only hire the best people, because we've interviewed a couple of them on the show.
Yeah, well,
now, why did you hire Dr. Joe Straight?
We started that from the time he was little. The intent was that...
Did you follow him along in his career?
Yeah, every step of the way.
Okay.
I mean, there's no difference between his educational background and Jeremy's.
Right.
Okay, so no, they're put in a position to...
So in other words, you knew about him, you followed him as a
The intent was always, the problem is that when you're a big group, you have to convince other partners that they will benefit from having him present.
Right.
And it has been, it's one of those things where I told them it was going to happen, and then it happened, and they said, you know what? You told us this was going to happen.
Well, you've got a lot of that.
The guys have responded well. It's been
a wonderful.
There's a good bunch of guys there because we've had most of them, the new ones that came on, where they've come from and what they do. Yep. All of them have been great interviews.
They have a good thing.
Okay, so now you remember the
now up until this time, he didn't have, when he worked for WorkPro, somebody else was telling him how they wanted to do things. When he was in residency and fellowship, they were telling them how they wanted them to do things. Now it's Joe Straight's turn to tell us what he wants to do, and he's gotten some new programs, one for concussion and one for ultrasound, both diagnostic treatment. All
right, let's hear about it.
So this is where we are.
Okay.
And this is the purpose of tonight, is to tell you about the new programs that Dr. Straight has brought to First State Orthopedics. Always been a colleague of mine, always been involved with game coverage. That part hasn't changed, but it's the new stuff, Joe. So why don't you kind of bring people up to date on how you're involved in the practice now and your autonomy as well as your collegial relationship?
I think being full-time and having more hours to spend with patients in a sports medicine setting has opened up more doors to being active in treatments of concussions. It's hard in 1 day a week or 1.5 days a week to take care of kids, adults that have had head injuries. when you need to see them a lot. So now that I'm there, it's great. The DIAA, part of the Sports Medicine Advisory Committee, and what Dr. Axe has done to put together a program for concussions for
which Dr. Strait is on my committee.
For our high school and youth in the state of Delaware. I thought that it would be something that I need to be involved in. I need to carry the torch for First Aid and be active in taking care of our patients, especially
it's a big deal
our high
right now.
schools, at our colleges and things like that. It is. I think that you're seeing more and more. I think people are being more vigilant about picking this up. I think parents are starting to see it more in their kids and noticing that they're not acting right, or hearing the complaints. And I think that all of the press and public knowledge out there has helped a lot to get kids to come in and tell us about it. I think back when I played sports, we didn't know. We didn't know what the concussion was, and we didn't say anything because we didn't want to be looked at as a whiner or something like that. So I think that it's out there now. I think that we've done enough, and this goes out to AI DuPont, the other docs that are taking good care of concussions out there right now.
Well, it's an integrated thing. We've got to remember that First Aid is responsible for well over 20 high school teams.
Right.
So we had an obligation to coordinate with Abby GoCare, one of our sponsors, to put together a program, and we've been able to do that, but we could not do it without Dr. Strait. It wasn't enough for me to go around. I didn't have the expertise in a lot of these subsets of things. He's attending national meetings. He's making sure that he brings to both my DIAA committee, but also to me personally, what's going on out there, that we want to be at the head of the pack. And
you want to be at the cusp.
We wanted to make, now he's got to be fiscally responsible and make logistic sense, Walter. We don't want to put ourselves in a position where we're doing goofy things that have to be rescinded.
I think it's one of the things that goes towards the Sports Medicine Advisory Committee. I think they've made Delaware very safe. One of the safest, probably the safest
state in the country
for any kind of sport out there.
All right, I'm going to give you a clue here that I've talked about for 10, 15 years now about soccer. I don't care what anybody says. When you get a high school kid that can kick the ball 50 yards in the air, okay, after he captures the ball, he can kick the ball 50 yards in the air, 9 out of 10 times, one of the other players or his players is going to hit it with his head.
Exactly.
Now, you can't tell me that 10 times, 15 times in the game, beside the other headbutt, that doesn't affect something somewhere, somehow.
I mean, let's talk about it in a nice way. We talked about concussion, and me and Dr. Axe were just at a meeting recently about concussions and the sequelae, the things that happen after multiple concussions. And the word everybody doesn't realize is subconcussive. So there's some subconcussive blows. You may not have a headache, you may not be dizzy, you may not have vision trouble, you may not be nauseous after it, but multiple subconcussive blows can do things as well. So we're finding that
like getting hit in the head with a ball 10 times.
10,
Correct.
15, 20.
Right.
Actually, the number that amazed me at this last meeting was 1,000 to 1,500 blows to the head in a season for an offensive lineman. It's amazing.
For an offensive lineman.
For an offensive lineman. So, I mean, they could all be subconcussive, but those subconcussive, which is non-symptom
Right, non-symptomatic, right.
They have to add up.
Right.
So I'm not saying that sports aren't fun and it shouldn't. I mean, I played football from 4 years old on. So I just think that we're going to find more things out as we go into the future about, is there a pre-genetic disposition? Is there other psychosocial things?
How about, and do people on ADD medication, it looks like it really does put you more at risk for delayed recovery from concussions.
Well, let me ask you a question.
There is something. There's something out there that's...
Does the medical field, beside you guys, like dermatologists, internal medicine, all those guys, do you feel like they are proponents of non-contact sports now? Like you see a lot of kids that have generated to soccer from football because of all this.
They do that because they can't play.
You just said that soccer was a concussive sport.
I think it is. Nobody else does.
No, I think
we do.
It's
a contact sport, but it's not a collision sport. You understand the difference?
There's a difference, yes.
Well,
you're not wearing special equipment so you can out and beat the crap out of the other person. If you're wearing special equipment to be able to hit somebody, that's like
lacrosse. I mean, you look at some of the things.
Well, Doctor, we had a boxer on. Dr. X said to him, "We'd love to have you boxers that we get a what do you call it?
MRI.
MRI before you start boxing. We could check it every time you have a." He was definitely against it. A young guy. Handsome guy, young guy.
There's
handsome
probably
guy.
a lot of different things into that. Insurance. There's probably a lot of things.
And I'll
that
tell you
go
another
into
thing that really surprised me is Dr. Oz. Everybody knows Dr. Oz from Delaware, okay? He was a big proponent of his son playing football. And I loved his talk about it and what he thought was important about football. You know, here's a doctor.
There's
They
a lot
asked him about, are you afraid? You know, and I thought it was great. And to get somebody with Dr. Oz who's so known and popular, just like Dr. Axe, when they, you know, expound the virtues of football, and I think that's a good thing. Because I hate to see it go away.
My answer, Walt, is that I don't think it's holding somebody back from any sport. And hear me out. I would never tell a kid don't play something. Now, if there's been many injuries, many head injuries, I may say, hey, collision sports aren't the best for you, okay? But I think that we're not knowing who's going to actually accumulate the repetitive trauma until it's already too late.
Yeah, so you
I think that's the issue.
So now it's your job.
Well, but doesn't it make sense perhaps that youth football may be delayed until it's at middle school instead of having the 5 or 6 year old?
I'm going to the kids playing flag football. I think it's a great thing.
I think it's a great thing.
I think it's a great thing. Did they run into one another once in a while?
Yes.
Yeah. But still.
We just said this. I've had a volleyball player. I've had a basketball player. I've had a cross-country person with a concussion this year.
A cross-country person?
So my thing is that it happens in every sport. It's just that where is the highest risk?
Right.
And that's
it's expected in football. It's the exception in other sports. There's the difference.
Yes, and all the studies are coming out of football right
exactly.
now. Because
they don't want to study mixed martial arts and boxing when the intent is to give them a concussion.
Look at hockey.
Well, hockey began as, listen, hockey began the whole concussion thing. Eric Lindros did a lot of things. We're going to go to a break and come back after this talking with Dr. Joe Straight and his new programs at First State.
I know they never make me play with these guys, but why do they make me train like them?
Training hard is important, and for professional athletes, it's their job. But kids aren't professionals and shouldn't train at that level. Keep kids safe on the playing field and out of the operating room. Become an advocate for sports safety. Visit StopSportsInjuries.org.
Hi, we're back on Youth in Sports with Dr. Joe Straight of First State Orthopedics, our friend and our co-host, and we're talking about some of his new programs. Dr. Axe, you had another program that
there's some new technology. There's always new technology. But
which you got from the horses, by the way.
Well, we did. Fiscal responsibility also enters into it. So when you bring in things in your office, it has to be compensated to the degree that you got to pay the loan on the particular piece of equipment. So First State has looked at ultrasound as both a diagnostic and also as a means to do different techniques that doesn't have any X-ray radiation to it and allows us to have a real high reproducible means of doing things.
We've used ultrasound for 20 years.
Mm-hmm. Yes, you have.
Had a lot of luck with it. And there's a new thing beside the ultrasound.
In medicine for a long time, and I think now it's.
What are you using ultrasound for? Muscle injury?
It is. It's for all of musculoskeletal medicine, and that includes joints, tendons, ligaments, hematomas, which are collections of blood in the soft tissues, soft tissue masses. We can look at. I've had many
collections of fluids.
ask, hey, can you just look at people who can't have MRIs? For
Right,
metal.
right.
Can you look at the
Well, now they got a
rotator cuff?
stand-up
Can you see-
MRI that my wife took the other day.
The MRIs have come a long way. I mean, just with the increase in the power, with the ability to.
But we
put
wanted
larger people
ultrasound
in.
that we could use in the office. So now on Monday nights, we have an actual clinic from 4 o'clock on, and probably will extend to noontime for Dr. Straight when he's at our main office all day on Mondays, to be able to both diagnose and treat. So you can make the diagnosis, but he's been doing a lot of tendinopathies, sick tendons that people have had for years and with a huge amount of success. And because you have the ultrasound there to help tell you exactly where you are, it allows you a more reproducible treatment plan. Now, I had been doing it based upon years of experience, but my success rate since we started ultrasound is even better than that. So what I do is I actually put the needle where I think it is, and then I check and make sure that it's where I think it is, okay? The younger guys actually put it in under guidance and put it where they want it based upon where the transducer is. That's another step that I'm in my learning curve for.
Well, let's tell people out there what it is. It's just like a baby ultrasound. I mean, it's gel. It's a probe, ultrasound probe.
Non-invasive. It doesn't go into the
There's no
skin.
radiation. There's no real risks without the injections, I say, but the risk of the ultrasound. You can pretty much do most of the joints. You can do most of the tendons, depending on how big the probe is.
Special problems with feet, the plantar fascia, that's just a bear.
It's so nice to actually see the pathology. So I think that you don't have to spend as much money with MRIs. I'm not saying MRIs are not used, but I think that it's a complementary study. It's dynamic.
Oh, here's the better one, Walter.
You get to see it.
You can actually see healing take place over time. So this is one of the reasons why I encourage physical therapists. Our university is going to offer courses in it so that you can use that as a means to advance a program in physical therapy by looking at the ultrasound of the structure that's supposed to be healing.
Well, I bought an ultrasound machine like 25 years ago.
Right.
Me and a couple other trainers chipped in. We bought one. And, you know, we didn't know what we were doing so much as we were experimenting, and it was great results. But you know how much an ultrasonic sound machine costs. Ooh. Consequently, that's why when you have those kind of treatments now, you know, just like the MRIs, they're so expensive.
Well, there's a difference between ultrasound and physical therapy, which is used to introduce heat and medication, than the one that we're using to do diagnosis.
Right.
We have a screen. Were you talking about one with a screen?
No, we did not have a screen.
No, you were talking about modalities. You were talking
like a physical therapist.
This is different, totally different.
This is like a baby. When you put it on
so you
on
can
an abdomen,
see.
Yes.
Yeah. Okay. We didn't have that.
So we can actually see the changes in tendons and ligaments, even in bones sometimes. I mean, I can tell you I've done some basketball players who have had bones sitting inside their tendon, their patellar tendon, where I'm able to actually watch my needle actually go into the bone, hit the tendon a couple times. What we're trying to do is stimulate some bleeding, some healing, so that they can actually heal their chronic injuries.
Well, you know, it's funny you said that, because when we put a blister on a horse, the object is, going back 100 years, is that it brings blood to the area on the premise that blood heals.
I think
they used to rub
that's
unicorns
what we're finding a lot as well,
like on them, you know, corn cobs to make them bleed. I mean, that was 100 years ago. But it's funny the way medicine has changed, yet come around in different ways.
At some point, yeah. I mean, there's multiple different things that we're doing. We do percutaneous needle tenotomy, which is through the skin and putting multiple holes in the tendon to injure it.
That's what we call fire.
That's
what we call fire.
There is something called PRP, which is platelet-rich plasma. It's actually taking people's blood out of them, spinning it down, and taking the platelet-rich part off.
Right. We do that too.
And injecting it back into a sick tendon or ligament to try to get healing from the patient's own growth factors, their healing cascades, all the different things that happen when we normally
using
have
biologic science at its height.
Well, okay. Here's something I never understood why it was against, is blood doping. You take somebody's blood, and then you give it to them again. It's against the law. You can't do it in...
Because they're trying to get an unfair advantage over a competitor. Not even close.
This is like more of a healing and an inflammatory process. It actually hurts. I mean, I don't want to say it hurts that bad, but it's sore.
Well, in this process, how long after I do it can a player play?
Heinz Ward played in 2 weeks.
2 weeks? Are you talking 2 weeks as a norm?
No.
Depends. It depends.
That's why it's Heinz Ward.
Okay, so a month you're talking maybe.
We're talking about actually making it feel better to play. You're talking about after the procedure, how long does it take for them to play? It depends on where you're doing. I mean, it depends on if you're in their Achilles tendon, if you're in their patellar tendon, if you're in their hip. It depends on what tendon.
Isn't it funny that all of this is kind of, in a way, based on acupuncture, that the Orientals used to do for 100 years ago, and we do it.
Well,
now,
there's a lot of techniques
acupuncture
out there.
The thing about acupuncture is when we do acupuncture, immediately, the first time you do it is the best. And then as you keep doing it, it gets less and less effective. Do you find that with some of your stuff?
I have not been that far into it yet. I haven't had to do someone
I'm anxious to hear you.
Yet. I am. And right now, I mean, looking 4 to 6 weeks is what we look at before we want to check it.
Do you think that you can change this and make it better and better?
I think it will progress as musculoskeletal medicine gets to look at the biologics and what's being put in, and if it really matters. I don't know if...
There's two groups of individuals that it's going to matter to. One is professional athletes.
Right.
The second one is our SEALs team. They take $1 million to train a Navy SEAL.
Oh, I'll bet.
So, and these people talk about getting banged up, okay? So
just the training.
Well, so a lot of our advancements have done on the military to keep our workforce guys out there with our premier guys, you know.
Oh, I like it.
You know, that's the group that has really benefited, and we've gotten a lot of stuff. Our trauma in our hospitals has benefited unbelievably with each war.
Oh,
whether it be Iraq or Afghanistan,
right,
the new things they bring back.
With the weapons and the medical treatment.
Well, I guess that's probably true, but we weren't going weapons this time. We were going medical treatment. I was using the resultant as opposed to the effector. So but these people are being studied and they are being done, and the research is out there, and we continue to do a fair amount. But it isn't cost effective, and I don't blame the insurance carriers and the government not wanting to pay for things until we can prove they work.
So that's why that's important what you're doing
out there that shows. I totally.
And whatever you do, whenever you do it, you research it, right?
Well, we try. What we do is our own patients. So in First State, we have my patients think I don't love them if they don't have to fill out some form that tells me how they're doing with a particular treatment that we're doing.
How honest are patients when they fill out forms? Mike?
I think they're pretty honest with me. Yeah. Well, here's what we're going to now, Walter. The newest thing. You're going to have an iPad that you get to fill out before the doctor. You see the doctor and they don't know what you said. With our goal being is we're going to see how honest people work, because they're going to be much more likely to be honest in that setting than when they come in the room, because they don't want to hurt my feelings. How you doing, Mr. Smith?
Right.
Hey, I bet you're doing great. I mean, you can really influence people how they do that.
That is true.
Yeah, it's true.
It should be done.
So, and that way we'll be able to give you more information. So when Dr. Straight and I say I'm involved with a company that has a rub on, you guys have been doing rubs forever, but we call them rub-ins because you have to massage them in. Well, I want to see what works for what. How many treatments does it take? How much better are they? And the studies, the outcome studies that we use have been proven to be right. It's called validation. So we can then take a difference in score and actually know if something is clinically relevant by an improvement in the score. That's been worked out too.
And we want patients to give us their honest answer. I mean,
I'm sure you do, yeah.
And I use some of this on like family members, friends to say, I know you're not going to lie to me. Tell me, how's this feel?
Right.
Is it helping you? Is it so?
Right.
I mean, we want that honest answer from the patient because I don't want to use something that's not going to help them.
Well, I know something that's on the cutting edge, and I don't know.
Oh, shoot, Walter, in the last 2 minutes of this set, tell us what it is.
Stem cell. Do you do any stem cell stuff?
Well, stem cells.
We had so much luck with bowed tendons.
PRP is partially like that. There's other people out there doing stem cell actually taking bone marrow and putting it back into
Have you seen any miraculous results like we have with bowed tendons?
We have seen some, but again, you have to choose your patient population. You can't ask one thing to be the
answer for everybody.
You can't. It just isn't. But here's what we are. You know, we always kid about I'm a splitter and I'm an axe, okay? That would make sense that would be the case. Okay. Now, we do try to divide up the problems so that together we're two people seeing folks as opposed to just axe or just straight.
Okay.
So that if we can identify what group we're studying, we have twice as many patients possible.
Right.
We haven't been able to do that yet with many of our partners in First State, but your insurance companies out there are going to be asking the doctors to validate what they're doing.
Outcomes.
We think that the magic word is outcomes, as Dr. Straight just said. So we are ahead of the curve because we already have a system ready to go and going, okay? So this will be something that'll be a little different, and I expect, you know, Dr. Straight to be involved in many things, but one of them is going to be to convince other folks, hey, these are the outcomes we use, and lead the way as a musculoskeletal expert. Because, you know, when you're a surgeon, all you want to do is talk about surgery. His job is to do everything he can
to prevent
surgery, or tell you right away
you need
it.
Right.
Okay.
Right. We got less than a minute left. It's been very informative, and I think that Joe, I take my hat off to you to doing the stuff that's, you know, right at the cusp of today's world.
I want to thank the partners over at First State and Mike for getting me over there and letting me to, you know, I mean, this is a dream I've had
for
I don't
paying
know how
you
long.
after all these years.
Yeah, he earns his money. He earns his money.
I'm just kidding. A little levity.
My thing is it's put me in a spot where the dream that I've wanted is there now, and now I can run with it. And
well, it's great to have young doctors to replace the ones that are, no offense, you know, getting up a little longer.
Listen, I replaced me.
There you go.
I'm okay.
And we got
I'm okay with what's coming.
Another act.
Hey, thanks for watching the show tonight. First State is doing their best to take care of you.
What does opportunity mean to you? At Wilmington University, it means finding your relevance in the job market. That's why we offer career-oriented degree programs that meet employment needs in emerging fields. Dedicated professors bring their real-world experience into the classroom so you'll graduate with the tools you need to succeed on the job. It's your degree. Make it relevant to your career. Personalized education, affordable tuition, that's the difference at Wilmington University.
This show was sponsored by ATI, the company taking physical therapy to a higher level throughout the country. First State Orthopedics, where Youth in Sports hosts Dr. Straight and Axe are members of the team taking care of Delaware with a commitment to excellence. And President Jack Barcelona and his Wilmington University College of Technology, where each semester this student-run program is produced, directed, edited, and distributed under the guidance of the TV production faculty. Each guest receives a copy of the show, and all shows are available on the web at youthinsports.com.